the category things we did not ask for 500, Alex. Liver spots, fondly referred to as barnacles on the ship of life. The medical term for these bad boys, seborrheic keratoses. I have an older video going over all of the possible treatment options that your dermatologist might offer you to get rid of them, to remove them once and for all. But is there anything that you can put on them to make them smaller, to shrink them, to slow their growth? That's what we're going to talk about in today's video. Now, seborrheic keratoses, they're really common. Tan, dark brown, sometimes black, warty appearing, stuck on, waxy bumps, often on the face, the neck, the arms, the chest, and the back. Really common after the age of 50. Importantly, these are not cancerous. They're not harmful to your health. 69% of people over the age of 50 are going to have at least one of these. Dermatologists diagnose, on average, 155 seborrheic keratoses a month. Wow, that is a lot of warty bumps. Because they're not cancerous or harmful to human health, they don't actually need to be treated, meaning you don't need to do anything and you can go about your life perfectly fine. However, about 43% of patients are like, no, we want to do something. We want to remove them, either because they're bothered by them cosmetically, the way they look, or in some cases they actually can snag on things, become irritated, cause itch, and be uncomfortable. As I discussed in my video on how to get rid of these, a first-line treatment option that is often offered, not only because it's super effective, but it's very cost-effective, inexpensive for your dermatologist to do, is liquid nitrogen cryotherapy to destroy the cells that make up the seborrheic keratosis so it'll fall off and go away for good. Unfortunately, this can lead in some cases to hyperpigmentation, hypopigmentation, and it can be uncomfortable. Alternatively, your dermatologist might shave it off with a blade. This procedure requires a little bit of numbing medicine to be injected into the bump, so an additional step, and likewise can be uncomfortable, can heal with hyperpigmentation, hypopigmentation, and even scarring. The thing that gets people down about the treatment options is that for the most part, because these are cosmetic and they don't need to be removed, well, your insurance is like, if they don't need to come off, we're not paying to remove them. In some cases, insurance will cover it if it's inflamed, irritated, symptomatic, but for the most part, you're going to be paying out of pocket to have your dermatologist remove one of these. And if you have just one, maybe that's not such a bad deal. So if you have many seborrheic keratoses that you want removed and you continue to make more, because again, removing them doesn't prevent you from making more, well, that's going to take two incredibly valuable assets, time and money. Despite what people might think, dermatologists would love nothing more if there was a simple, inexpensive cream that people could buy and put on the skin that would just melt these away safely in the privacy of someone's own home. People are under the impression that we like taking these off so we can make money. Listen, trust me when I say derms would love nothing more than if there was a magic bullet that would cure seborrheic keratoses, because we know firsthand how annoying they are for patients. It's very cumbersome, very time intensive for both the patient and the doctor to deal with them. We need to discuss certain topical alternatives to procedures for removal. I would be remiss to not talk about hydrogen peroxide, because I get a lot of questions about this. And if you watched one of my very early videos on seborrheic keratoses, like 2016 era, well, you'll recall me talking about hydrogen peroxide. 40% hydrogen peroxide applied to a seborrheic keratoses leads to a lot of reactive oxygen species formation and cell death to destroy the little bump. Back then, there was a approved drug called Escada, which was 40% hydrogen peroxide. Now, to be clear, hydrogen peroxide that you can buy in the store, very weak. So if you think you're going to get results with that, you would be mistaken. If anything, it'll just be irritating to your skin. But 40% Escada, it was actually decently effective at removing these. The problem with it was that it had to be applied in office. Your dermatologist had to apply it like 4 times in office with a little pen so as to get it right on the spot and not damage the surrounding skin. And it caused a lot of irritation, discomfort, oftentimes a blistering rash, and it didn't always work. So for the patient and for the dermatologist, it's like, is this even worth it when we could just zap it with liquid nitrogen and not go through all this hassle? And guess what? The drug did not make the company any money, so they pulled it. It's no longer available. So that's the hydrogen peroxide story. Now, a question I get a fair amount is, what about this bad boy? This is a adapalene gel you can buy over the counter without a prescription. It's FDA approved for the treatment of acne. But you guys have probably picked up on the fact that dermatologists, we try stuff, especially retinoids, on other things, and a lot of times works out. So topical retinoids, big category. Tazarotene, a prescription-only topical retinoid. Tazarotene 0.1% specifically applied twice a day for 4 months. In 7 out of 15 patients, they got significant improvement in the size of their seborrheic keratoses. Some of them, though, did develop side effects of burning, redness, and itch. Now, Tazarotene, at least here in the US, does require a prescription, so you still have to go through your doctor. There was also a case report of a patient who applied tretinoin 0.05% to their seborrheic keratosis for 4 weeks, didn't get anywhere with it. Now, that was kind of a short amount of time. So it seems like from the topical retinoid research that we have for seborrheic keratoses, if they're going to do anything, you got to be patient. You got to use it for at least 4 months. Like I said, adapalene, different gel, or any of the other brands that sell adapalene 0.1% over the counter without a prescription. Is this going to work? We don't know. No one's really looked, but adapalene is a retinoid similar to the others, so it might help shrink them. No promises, no guarantees, and you likely have to use it for a long time to make a dent in the seborrheic keratosis. A lot of you guys who watch my videos on the regular, you have already asked this. What about urea? I think I even brought urea into the conversation on my older video on how to get rid of these once and for all with all the different in-office procedures. But a urea 42% cream applied twice a day for 30 days to 20 individuals with seborrheic keratoses resulted in a 24% average decrease in seborrheic keratosis size. Now, this is in comparison to good old cryotherapy, which, like I said, super effective, cost effective, but the whole going into the office, paying, yeah, we get the downside. Cryotherapy, 100% reduction. I mean, gone, right? So a reminder, none of these things we're talking about today are going to melt the seborrheic keratosis off, get rid of it, like cryotherapy would. Now, 42% urea is pretty strong, okay? Keratolytic strength, very, very strong. But of the people using it, 19 out of 20 had like no side effects, really happy with it, all right? It can burn, it can sting, it can be super irritating, especially on the face. It's not meant to go on the face. So if you have a seborrheic keratosis on the face, be very, very cautious. Regardless of where you have them, you would only want to apply the high percentage urea, 42%, which is what has been looked at, just to the bump. No need to spread it all over the place. If you have a lot of bumps, just be patient and put it on with like a cotton tip applicator to each one. And you don't need a big glob on there. Just a thin film is all you need to get the urea down in there. Now, urea, like I said, it's a keratolytic, so it gets in there and it breaks up cells and stuff and exfoliates. So you might get a lot of flaking, peeling of the seborrheic keratosis. It's possible it becomes inflamed and uncomfortable for you. That's a possible side effect you might encounter with urea. Once the bump does become really flaky, so long as it's not uncomfortable or red or oozy or anything, you might soak it a bit and gently mechanically exfoliate it a bit with a damp washcloth to help slough it down. But don't try and exfoliate or sand or anything like that. Speaking of keratolytics, you also have 12% ammonium lactate, aka amlactin or lachydrin, applied twice a day for 16 weeks, reduces the height of the seborrheic keratosis, but not the width. So not a huge change, but you may be motivated to, especially if you have a tall one that's getting snagged on things. Well, you might be able to flatten it a bit, decrease the height with amlactin. But here's a treatment that flies under the radar. It's not really well studied for this, but there is a good trial using it. It's something over the counter. It's safe, it's well tolerated, and it's used at higher percentages to treat pre-skin cancers called actinic keratoses. And it's called Diclofenac, 1% Diclofenac gel. Brand name Voltaren, but if you go into the drugstore, sold over in the area where they have the topical pain relievers, 1% Diclofenac applied twice a day for 8 weeks significantly decreased seborrheic keratosis surface area in comparison to topical ibuprofen. Topical ibuprofen didn't do anything. It likely works by triggering cell death. Again, to use this, you only need to apply it to the seborrheic keratosis. Don't just go smearing it all over the place because that's unnecessary, might be irritating, and more expensive. Topical 1% Diclofenac, whether it be the brand name Voltaren or the drugstore brand like CVS version, Walgreens version, pretty inexpensive for a tube. I want to say it's like 10 or 12 bucks. Pretty inexpensive. You don't need very much, just a thin film on the bump twice a day. These are thick, all right? They're thick, and so by treating it twice a day, it really gets it in there. Comment below on if you were surprised by that. Like I said, it's not a super robustly well studied, but the study that we do have was done pretty well. And topical diclofenac, at least at the 3% prescription strength, is an effective intervention for actinic keratoses, which are those rough, scaly pre-skin cancers. So there is a mechanism there. There's a track record, and while it's not well studied for seborrheic keratoses, it really does show a lot of promise for at least decreasing the surface area, which, like I said, that might be really a big game changer for you by just debulking them and by helping to cut down on irritation, especially if you have them on the neck. The neck ones tend to be really annoying because they get caught on your collar, they get caught on your jewelry, they bleed, they can be a pain. So in summary, as far as stuff that you can get in the drugstore to put on these that shows the most promise for cutting down on the size in order of likely to help: 1% diclofenac gel, 42% urea, 12% ammonium lactate, just for height, and question mark, no research, but mechanistically makes sense, adapalene, 0.1% gel. Some people also report good effects with wart treatments like compound W that have a high percentage of salicylic acid in them. We don't have many studies on salicylic acid alone for seborrheic keratoses. Usually it's pursued in combination with things like something called 5-fluorouracil, or as I like to call it, the FU cream, because it really causes a lot of irritation. But those would be the things that you might entertain the idea of pursuing. Importantly though, talk to your dermatologist. Talk to your dermatologist or your primary care provider. To make sure these are actually seborrheic keratoses and not something else, because like I point out in a lot of my videos, what looks like one thing might actually be something else. It may be something more concerning, for which these things are not only going to be unhelpful, but might complicate the picture. And talk to your doctor about what they think about pursuing these things. This is not medical advice. I'm not telling you to do these things. I'm just here to provide educational information on research into topical alternatives for the treatment of seborrheic keratoses. I hope you guys found this video informative. If you missed my video on how these are removed once and for all, you need to watch that. Familiarize yourself with the procedures that are available. Check that video out next. I'll put it on the end card. But if you guys enjoyed this one, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.